Welcome in, everybody, to the My Pets Wellness Weekly Wellness Podcast. My name is Kevin Crispin. I'm the Chief of Staff at My Pets Wellness. Good to see you again. I am here with the returning champions, Dr. Jason, our Executive Medical Director, sir. Dr. Rodney, our Director of Wellness and Personal Growth, sir. I am Mr. Crispin. We are going to go into our third part of our three-part series on anxiety. If you've been a fan of our podcast and have been following us along, it is definitely a theme and a lot of what we talk about. Mm-hmm. But these past three episodes, we've wanted to focus in directly on anxiety in a more specific way. So we've talked about what anxiety is. We've talked about seeking help and how to cope with anxiety. And now, in the season finale, we're going to talk about how to cope with anxiety in the veterinary medical world. Again, as you know, if you've seen this podcast or listened to us, it's something that we talk about a lot. So we're going to really turn to you, Jason, as the veterinarian on the panel. I want to ask you this. You've been a vet for years now, and all jobs can induce anxiety. Except for chief of staff jobs. And but would you say there's a higher likelihood to experience anxiety in the vet med field?
Yeah, I mean, yes, I think so. It could, depending on what you're comparing it to. If you're comparing it to someone out as an EMT, maybe not. But I think that there's a lot of different components to what we do as veterinarians that can put you in a situation to where you're anxious, whether it is a normal response because it's just a scary thing that you're about to go do, or it's a situation that has happened and gone the wrong way, and now you're anxious about it because you have to do it again because you just left an exam room and now you have to go into another room and do the same thing that you just had like a bad experience doing. So
that is, sorry, that really hit home for me right now because that's yet another thing I have not considered that vets have to go through. And the fact that you deal with one thing, it goes poorly. Well, too bad you're going in because the next dog or cat or animal is going through the same thing. And God, that is a whole other level of stress.
Or just the days where you have like 6 appointments that say aggressive, will bite, muzzle. Mm-hmm. And you walk out of one room having your tech just gotten bit. And then you have to walk into another room and hope that the muzzle gets on before somebody gets hurt. And then you have a puppy and you're like, okay, I can. And then your next appointment is another kiddo that's known to try to murder people. And so
it's like that roller coaster the day that I've talked to you and Dr. Jessica about, which is really hard to get, maybe even to get your bearings.
Yeah. So you can have days like that where your anxiety is legitimately like, I'm going to get hurt because I know, I know Marley's coming and I don't like, Marley doesn't like anybody. Or there can be anxiety. I can go back to my first year in practice and the first in-home euthanasia I had to go do. And I walk in and it's in their living room and there's about a dozen people there, including someone with this like camera that looks more expensive than my car. And they were like, yeah, we all spent the night in the living room on the floor with him last night. And we invited so-and-so over. He's a professional photographer and we just want to all be here. And it's like, cool. Hope I don't screw this up. Like this is not good.
This was wow. Okay.
And it was a white boxer. But into the story, it all went well. I have a beautiful piece of wood that they laser etched a portrait of Parker, and it's still in my desk. And that was a long time ago. So, they were a very kind family. But that was back in Colorado. But like you go into that, and it's like, all right, I hope this is I can't screw this up. Like you can't.
That you're right, and literal life and death situations.
So there's a lot of different, so you can run into anxiety for physical fear. It can be performance fear for a euthanasia procedure that is the 2 most important times a person comes into the building is when they come in with a brand new puppy or they come in to say goodbye. And those are the ones where you have to be on 100%. You have to really be either there as an educator and as an excited, like, I love your animal, or there as a emotional support human for the people in the room, because you have to be the strength to go through something like that. And then you can have anxiety over something that you're scared to do. I've never done this surgery before. I did this surgery before and it went really bad. One of my first spays in practice, I did everything right. And from the very beginning, everything went very wrong. Like you pinch the belly really gently and you take your blade and the point is up and you barely stick it in to make a little teeny hole. That way you don't like take a knife and go into the abdomen and stab stuff you're not supposed to stab. And I did everything the way I was supposed to do. And there is a piece of what's called omentum. It's this like fatty thing that wraps around the intestine. It's very vascular. And this dog, it was stuck right underneath the skin. So when I pinched just that little teeny bit and poked, blood just started coming through the abdomen. And I'm a month out of school and I went, I need help. And my boss came to my rescue and we figured it out and dog did fine. But the next time I had to go do a spay, I was a little scared.
Yeah, I mean, I'm a little scared. Dr. Rodney, do you have some time after this?
I was going to say, I can see your reaction here, Kevin.
Yeah.
You're having a hard
but the
time
dog
with
was okay. I can't even imagine.
Fine.
Like if most jobs, not all jobs, granted, but most jobs, if you make a little mistake like that, it's like, oh, that's a mistake. We'll learn from it and try not to make it again. That is, again, the life or death.
Yeah. But you learn there's a difference. A new grad, any little bleeder, it's like, what do I do? And then now at this stage of a career, it's like, that's bleeding. Let me get gauze. All right. Something's bleeding.
Yeah.
Shouldn't be bleeding. Let's figure this out. Like you just, it's like, I'm holding it. It's cool. Like I got time. They have a lot of blood.
Yeah. And speaking to the importance of pets in our lives, Dr. Rodney, we spoke last episode about dissociative acts and finding comfort in our senses and focusing on those. And obviously we had a dog at that time who came up and was in the shot. So my question for you is, how often do you find, you hear the term emotional support animal a lot. How often do you find that is really something that people rely on when they are struggling really hard with anxiety? And what do you think is one of the most effective parts of having an emotional support animal as opposed to maybe some other way to treat the anxiousness?
Well, having an emotional support animal is much more healthy than doing heroin or cocaine. You get what I'm saying? But it's kind of like,
yeah, that's true.
It's really the same mechanism. You know, you're just trying to escape your pain. A lot of people definitely, as you know, connect with their animals, and they feel close to their animals, and that animal does emotionally support them. And so it's a much better connection than acting out in some other way that's going to make your life unmanageable in a way that is not really healthy. You have to be careful, I think, that the animal itself does not become an object that you're using for yourself, as opposed to you treating the animal for what and who it is. I don't know if I said that right. You know, because the concern can be that you can begin to use it as a tool to support yourself, and you no longer see it as a live, breathing animal. You get what I'm saying? Did I say that right?
Like a teddy bear concept. Yeah. I love you when I'm sad, but go away when I'm happy.
Right. That's what I was trying to indicate.
Yeah.
So then it goes from the emotional attachment to them that supports me. Now, okay, where's my dog? I need it right now, without it ever concerning yourself with the fact of that the best time for the dog to interact. I don't know if I said the wrong thing there, but I was trying to make sure that you realize any coping mechanism can have negative consequences, you know, drugs and alcohol.
Yep.
But even an emotional support animal, when it becomes out of control, or when you're using it as a thing to help you, I'm concerned, because I believe in the value of the animal as a separate individual from you. Am I saying it the right way?
Yeah. Yep. Okay. So Jason, you know, you've always been on these episodes pretty open about your anxiety and everything, and you've shared some experiences with us today: the at-home euthanasia, that early spay. As a more experienced doctor now, have you been in a situation with maybe a younger doctor just graduated, just starting out, where you have seen that she or he is having an anxious reaction to something, and how did you address it?
Yeah, that's a great question. I've probably said this before. I love to teach. I enjoy helping doctors and technicians grow and better themselves. And so I've encouraged associates to try new things, to do surgeries they've never done, to, dentistry is kind of my little area of passion. So yeah, put that crazy dental on your schedule. I'm here. I got your back. Mm-hmm. And so I heard and sensed the hesitation. And ahead of those moments where I know they're anxious, meeting with them, talking to them, saying, hey, I know your skills. I know you got this. Here's the materials that I read to like brush up on it. Here's the YouTube video I watched of a specialist doing this surgery, just to like have an idea to visualize what you're going to do. And along with giving them all of that training and those tools, it's when it comes into that moment when that's what they're faced with, mm-hmm. I've made it a priority to be available and let them know I'm here if you need me. My last position in clinic, I had a couple of doctors that were really great veterinarians, and they were learning and getting more and more comfortable with advanced dentistry. Mm-hmm. And so anytime they were in a major procedure, I would usually be in the exam rooms, and I'd walk into the room and be like, hey, we've got a dental on the table. They may come get me if they need me, just so you know. And I would tell my clients that, right? That way they could walk in and be like, they need you in dental now. And I'd be able to go and help, and clients would understand. And just offering that support, I think them knowing I was there. And then a lot of the time when I'd show up, I wouldn't do it for them. I would coach them through it. Because you're not going to fix somebody's fear of a procedure or scared they're going to do something wrong unless they do it. So coaching and teaching and saying, yeah, no, that's what you're supposed to be doing. That's what it's supposed to look like. Keep going, and mm-hmm. staying there and helping them get through that and get over that experience rather than just taking it over, is how I've really, it's a sense of pride. I love it. Like, I love being able to help people get through those things.
Yeah, and you weren't kidding about the passion about dentistry. One of the first times I spent time with Dr. Jason, we'd gone out to dinner, and we were waiting for our food to ingest, and he's like, hey, I got a bunch of pictures of dogs' mouths on my phone here, and I was like, what am I looking at here? And it's been going well ever since. So, Dr. Rodney, on kind of the stories, one, that Jason has told as suffering anxiety, and two, kind of the leadership he's taken and teaching and helping people through anxious moments, do you have any advice for Jason in the situations that he or another veterinarian may find him or herself in when they're anxious? Any advice with how to cope with it in the moment, how to get past it, that type of thing?
Well, okay, so let's say, giving an example is I'm going into a room and I just messed up in the other room.
Yes. Good one.
Okay, so let's go with that one.
Yeah.
Before you walked in, you have to collect yourself. Okay, mm-hmm. But then maybe you just need to quickly reach out to somebody to say, right now I am a little anxious, but can you just talk me through that and remind me that I'm a good vet and give me support in that way, so that you don't walk in the room with your hands shaking and sweating, and so that the animal or the family, if they're in there, sees that anxiety already creeping up. So you just have to, when you notice it's coming, you prepare for the next step. And there's still no substitute for letting another person support you in that way and just remind you that you know what you're doing. Even though that didn't go right, you can do this one right. The fact that went wrong doesn't mean that this one's going to go wrong. Because then, if the anxiety is overwhelming to you, you'll go in and you'll do it wrong because you're trying to not do it wrong. If you get what I'm saying, you're so, you don't go through your normal technique of how you do it because you're kind of overcompensating for what happened in there. So you get somebody to remind you of your skills in the vet area. I think that would be a very helpful thing.
Yeah. So I wanted to ask you, do you have peers that you would reach out to if you had a really bad day at the clinic, where you had a couple things happen and then your confidence was shaken, or you're feeling anxious about a number of things, where you would reach out to, say, your friend Earl and say to Earl, hey, who's also a vet, I had this issue today. Is that something that you find in the vet world, or no?
Some of us have it. Mm-hmm. Some of us don't. It's usually other doctors, other associates in your clinic that hopefully you have at least one that you're close with, that you can be vulnerable with. Not everyone has that. And then some of us keep in touch with doctors from afar. Dr. Rodney, my friend Lindsay in Colorado, she called me last night.
Did you?
And so I actually forgot to call her back. But
Are you anxious about that?
a little bit.
I'd be afraid of her.
But no, we're good. But I think there's not all of us have that luxury. But most of us find it in a coworker or keeping in touch with vet school classmates.
Mm-hmm.
It's the perk of working in 2020. It's pretty easy to keep in touch. My first year, I even kept in touch with one of my really good friends through vet school who is moved to Australia and practices in Australia. So I'd be in the middle of my workday, stressed or frustrated or overwhelmed or whatever, and we could Google chat because it's like 8 a.m. and she's getting ready to go to work or getting off. I don't know how the time changed the other side of the world. I don't know. I don't remember. It was a long time ago.
Think about it like with dentistry with dogs.
Okay, sure. Yeah.
Cool. So to that point though, on a previous episode, we had Jamari on, who has been a vet tech for 13 years. And one of the things she came back to over and over again was about that relationship between the tech and the doctor. And you spoke to it too from the doctor side just now, like having that person you can confide in. And that tech goes in, it does some prep, I believe, and is able to let you know kind of what you're walking into with that animal. And then afterwards, they can probably be someone to lean on and talk to, and talk through that.
And that owner.
And okay, yeah.
Usually, because most pets are fine. Like it's rare that we have aggressive or whatever, but it's nice to have a tech walk out and go, all right, this one's cray cray. You're going to have to interrupt them because they're going to talk for an hour and a half about nonsense. And they're mad because their other vet did A, B, C, D. So like they can prep you for those sort of clients, which can it's nice to know walking into.
Fair.
But I'm glad you brought up Jamari and technicians because that's one thing I was actually thinking about when you were talking, Dr. Rodney, is, we focused a lot on doctors' anxiety. But I think, the statistics are there. We've talked about how veterinarians are 3-ish times, I think it's around 3. I can't remember the exact number, but around 3 times more likely than the average person to commit suicide. Vet techs, it's closer to 5. And so because not only do they deal with a lot of the same anxieties we have, but they tend to get the brunt of it, especially from the super type A, high demanding, vocal, boss-like leaders that we have throughout veterinary medicine. Not that that's what should be, but that's what's there. A lot of us have experienced it as doctors with one of those bosses. And technicians, we think we get it hard from those people. Technicians get it twice as hard. And so, making sure that the technicians that are watching know that you can use these same tools, whether it's a doctor or a tech to confide in. It's important that you guys are taken care of because I've seen more technicians break down crying at work than I have doctors.
Wow, that's a sobering statistic. I did not know that, and I think it's a good reminder of why we are continuing this conversation among us, among other team members, and of course during your doctor support group that you guys do every Thursday night,
which technicians are welcome to.
And technicians are welcome.
It used to. We started it as a doctor group and realized that it needs to be more widespread, and so wellness rounds are every Thursday at 7 Central. And we call them wellness rounds because as a breed, veterinarians don't like to admit they need help. So the idea of support group, we didn't want to stigmatize it. So we call them wellness rounds, but it runs support group like.
Okay. And I think that's a good place to stop with our series on anxiety. And to the point that you just made about veterinarians, about technicians and the higher rate of suicide, it's very important. Obviously, if you are struggling, hopefully you have that peer group. You have someone that you can speak to, as Dr. Rodney always says, that safe person that you can talk to and seek help. And we also have those wellness rounds, as we said, every Thursday night at 7 p.m. Central. So just know that you're not alone, and there are a lot of ways that you can get help and and everything.
There's
So
a lot of resources. UT has resources. NOMV has resources. We're building our resources. You know, there's, for anyone that's out there struggling, you'll find what you need. You just have to be willing to ask for the help to find it.
Yep. Great.
And I think that's a great note to end on. So, Dr. Jason, thank you, sir, for your insight and your stories today. Dr. Rodney, as always, thank you, sir.
Thank you.
And thank you at home for watching and or listening. If you want to learn more, you can always go to mypetswellness.net and find out there. And until next time, we'll see you on the Weekly Wellness Podcast. Thanks for stopping by. Take care.
Bye.